emergency life-threatening procedures where obviously any parent would be anxious with their child. We'll give a syrup or we'll give the gas with balloon or something so that the child doesn't know the pain, doesn't know the trauma. So we had a 3-year-old, 4-year-old child who had liver cancer. He's already been operated once. If you're a fresher, you will earn anywhere from maybe 80 to 1 lakh minimum.
We have got a lot of claims actually that, ma'am, should I take up anesthesia? I've got this stage, should I let it go? Let's address that this is a surgeon dominated field. So, do you think we are undervalued here? Hey guys, welcome back to Every Tales podcast. Today we have Dr. Soumya, Consultant Pediatric Anesthetist with us.
Hi
Welcome
guys.
to our show.
Thank you. So I'm Dr. Soumya. I'm a pediatric anesthetist and I work in Bangalore in a maternal and pediatric hospital.
Nice. So, how is general anesthetist different from a pediatric anesthetist, ma'am?
So kind of when you get down to it, anyone who has done their MD or DND anesthesia can handle most cases, pediatric, neuro, uh, onco cases. It depends on how much experience you have. So when it comes to pediatric cases, I finished my Rajiv Gandhi University fellowship. So basically, I worked for a year in a complete pediatric hospital, and for that 1 year, I got only pediatric cases and nothing else. And it just gives you more experience. And when you do pediatric every day, the little nuances like how children react to anesthesia, how you have to take them in, and how you take them out, just little differences that help you get used to it as you do more cases.
I
So,
mean, how do you explain all this to the parents?
So, yeah, like when you have adult patients, the thing is that you will be usually talking to the patient themselves because they're above 18, they can give consent. But when it comes to pediatric anesthesia, most of your kids will be less than 10 and they're not legally allowed to give consent. So, along with explaining to the child, explaining to the parent is also a big as part of what we do. And as far as I've seen, the parents are not so much into semantics. You don't have to go about the drugs you give or anything. What the parents usually want is they want to be confident that you are going to take care of their child, the child is going to be safe, and they want to know that you care. So when I do a PAC or a pre-anesthesia checkup of any child, uh, what my mentor had told me was, especially children who are above the age of 5, if they know what they're doing and if they can understand what you're saying, it's always important to get the child involved too. So it's not that you ignore the child, only talk to the patient, their parents. Get the child involved, explain to them what they do, and when you're talking to the parents, like I said, you explain the type of anesthesia. They just want to know that their child will be safe. The child will not have any physical or mental trauma after this, and that you look after everything and that they'll be around and updated about their child.
I'll give you an example. Have you come across this kind of a situation where usually the parents consent to the procedure because child is underage and cannot consent? So if there is a life-saving procedure and the parents are very anxious and comprehensive that no, this procedure might be life-threatening, but you want them to agree for the procedure. So how do you go about that?
So when it comes to such like emergency life-threatening procedures where obviously any parent would be anxious with their child, one good thing is it's not all on me to get the consent. It will be a team. So the surgeon or the physician and the anesthetist will have to convince the patient that this is the best chance we have to save the child. There may be risks, but also like how we tell to adult patients, from our side we do the best we can and we try to look out for complications. We explain to the parents that these are the complications that might happen. This is how we're going to optimize your child to make sure we get the best outcome. And we also let them know all the facilities we have to take care of the child if any of these complications do happen. So I luckily, no, I mean, it's rare that you do end up losing a patient. That's touch wood. It's almost never happened, but yeah, complications do happen. But you have to just explain it beforehand and make sure they understand. And most importantly, they should know that if we don't do this procedure or if they do not agree, the complications or outcomes will be much worse than if we do go ahead with the procedure. So as a team, it's usually easier to convince the parents and the family.
So it's a multidisciplinary approach.
Yeah.
Do you come across such a case? Do you remember any case which challenged your?
Oh, definitely. In my previous hospital, we had a 3-year-old, 4-year-old child who had liver cancer. He's already been operated once, and unfortunately the cancer came back even after his remission. So he was, to look at him, he was like an absolutely fine child. He was playing. He was admitted for around 2 weeks, and but we had to. The surgeons had to operate because the liver was just expanding and he was going to get worse. So the surgeon decided to go ahead, and we spoke to the family. They knew the complications that could happen. And after opening the child, we found out that the damage was much worse than expected. It was a very long surgery, and at the end, they did what they could. We had to shift to the ICU afterwards, but because of the extent of the disease, the child didn't make it in the end, which was sad for all of us. Everyone was quite attached to the kid, which is the downside of working in pediatrics, I guess. But the parents also knew it is just an unfortunate. It was not anyone's mistake. It was just fate, I guess. But yeah, like this, these things are rare, but it's part of the job. I think.
Part and parcel of the job where you have to face all this.
Mm.
So, I mean, most of the parents have this question. I feel that is anesthesia. I mean, does anesthetic agents, hinder the child's development or anything like that?
So yeah, studies have been done on this. So for example, if you have like a 3-year-old who's coming for a surgery, maybe a hernia, which is a one-time thing. So definitely the drugs which we use are all short-acting. They get washed out from the body quite quickly. So in these kids, you don't expect any long-term side effects. But other kids who have repeated surgeries in their neonatal period or within their infancy, so within 1 year of age, if they're repeatedly exposed to anesthesia and they have longer procedures and recurrent procedures, then they do say that maybe the development of the child is slightly hindered, maybe a little bit slower. But this, you cannot exactly blame only anesthesia agents for this. This also can be because of the repeated anxiety, the repeated pain post-op period. These other factors also play a role in this.
Yeah. So they are also very, they are worried that will the kid have awareness inside the operating room, and will he remember, will they have nightmares afterwards?
So what I do is, or what our team follows is, we make sure the child is almost sedated or asleep before we take them into the OT at all. So I know some people, it's easy to just pick up a child, force him into the OT, put an injection and put them asleep. But these traumatic things have effect in the later life. So what we do is we usually sedate them pre-op before pricking. So they won't even have memory of getting injected. We'll give a syrup or we'll give the gas with balloon or something so that the child doesn't know the pain, doesn't know the trauma. And we do all of this in the presence of a parent. So it's not a kid along with all these strangers. So the parents will be there, and kids are usually comfortable with that. So before they even know what's happening, they'll be asleep, and we try to keep it as comfortable as possible, either with music or videos, YouTube, whatever. And so when the surgery is going on, we make sure the child is asleep. And awareness, it is our job to make sure that the kid isn't aware throughout the surgery.
But as far as I have attended your cases, you take a step ahead. I mean, I've seen you getting chocolates and stickers for them that they feel comfortable.
Yeah, I mean, I think that's why I chose to be in pediatric. I think I have more empathy towards kids, and I have a lot of kids in my family who I'm quite close to all kids. So I enjoy working with kids. I truly do. So I think if it's something you're passionate about, you tend to go the extra mile. And I think kids also, the happier they are going under anesthesia, the happier they are coming out of anesthesia. So I think that just adds up to that.
So, given all this, do you think our branch is medico legally safe?
No branch in medicine is medico legally safe. Everyone, you are at risk, but again that depends on the team you work with. So if you do work as a team and the surgeons are good, you have a good rapport with the team, the hospital where you work with. If you have good backup, then it's difficult to get into medico legal cases, and that's why we have all our protocols, consents, and explaining everything to the patient beforehand. So I've luckily not fallen into such problems. But I think, yeah, everyone has this notion that blame the anesthetist if something goes wrong. Sometimes that does happen, whether it's our fault or not. But ultimately, when like this in a corporate setup, we all work as a team. So it's never one single person's fault or responsibility. It becomes a team responsibility.
Any checklist that you have that you follow, that okay, these things I should do prior to surgery, I can keep myself safe.
Yeah, so like anyone else consents, and if you are expecting any particular complications in a patient, explain that to the parents or the patient party. Make sure everyone's on board. Make sure, I think, good communication. Anytime when the anesthetist, the surgeon, and the patients, the nurses, if everyone is well communicated and all the complications are discussed, you can avoid long-term complications most of the time.
I think this is something that every aspiring anesthetist should keep in mind to not just jump to learn the procedure, but to take consent and to explain to the patient. I think so. And in this, this has been there in so many questions or so many doubts that let's address that this is a surgeon dominated field. So, do you think we are undervalued here?
Um, I think when you take anesthesia, it's known you will not have the glamour and the fame like a surgeon does. So what I always say is surgeons and physicians they run behind patients, but it's our job to kind of please the surgeons. So there no patient is going to come to the hospital asking, I want to see the anesthetist. But the surgeons do value you, especially I think surgeons, it's not about how good you are. I think it's difficult to be a bad anesthetist. After some time, if you have enough experience, you know the basic things. Everyone more or less does the same anesthesia, but it's about how comfortable you make the surgeons feel and how the surgeons are used to your ways. And so I think it's about, I don't want to say pleasing the surgeons, but I think keeping the whole OT, the whole team quite stable and being calm and being
I mean, we say that if the anesthetist is not sitting on the chair, if he is alert, that means there is some complication. If he is relaxed, that means the OT is running smooth.
Yeah. So if we are on our phone and we are chill and having a fine time, the surgeon's not worried. As soon as we get up to look at something, the surgeon's like, "Is everything okay? Is everything?" So yeah, I mean, I think we learned that in first year of our residency that it's important to keep calm no matter what's happening, even if things are not that stable. If you are calm, everyone else is calm. If the anesthetist starts panicking, everyone's gonna panic. So I think that's rule number one. Whatever is happening, stay calm, have a cool mind, and see how to proceed.
How do you keep your calm up?
I think it's just over years of practice. I mean, I worked in many different types of hospitals, and when you're younger and you're a resident and you see a lot of complications and you see how your seniors deal with the complications, that just gives you more confidence. So it's not about having no complications. It's about if a complication happens, do you know how to treat that and make everything stable? That's more important, I think. So with experience, it's just something that comes to you.
I mean, also, would you like to answer this question? Like, how much does an anesthetist earn in India?
I think according to any branch, there's a wide range. And it depends on where you work, whether you're in a metro city or a rural area, and depends on what you're specialized in. I think you can say so. In the city, everyone has done everything. Everyone is competent in everything. So there's not like so much demand. You can't ask that much. But whereas if you're in a rural area, if the surgeons know that you are good and they can trust you, then you can kind of demand a lot. And I think maybe the cases may be less, but how much you earn per case will be more. So I guess in general, you can say if you're a fresher, you will earn anywhere from maybe 80 to 1 lakh minimum. And maybe at the peak of your career, if you're the head of department in a big corporate hospital, you have a lot of work under you. I don't know, I've not asked, but I'm guessing maybe 10 to 20 lakh per month might be, depending on where you work.
So, is this same for all the cities, metropolitan cities? Like,
No, I know that in North India the salaries are better. South India maybe it's a bit less. But then again, depends on if you work as a team or if you're in freelancing, or you do private practice, or if it's a mix of both. So
Okay.
really depends on that.
I mean, what is your opinion, ma'am? Should we just settle for a full-time corporate job, or we can do freelancing, or both?
At least according to me,
Hmm.
I like having a good balance. So I value my peace and my time a lot more than my what money I make. Money is important definitely, but I also value my peace and time. So there are some people who are okay working 24/7. Call me whenever you want, middle of the night, I'll come for any case. So in that case, definitely those people, if they're doing private practice, you can really earn a lot and have good money. But I feel what I feel is being safe. So working as a team in a corporate practice, having a backup all the time, having fairly fixed shifts, and like getting a fixed salary or with few cuts or whatever, with decent good salary, but at least having time to go home most evenings and spend time with your friends and family. I think that's a decent balance. So I
So you mean to say work-life balance is not something which is generalized. It is
it's what you choose.
individualized.
Yeah, I
Yeah.
think no matter what branch you're in, I feel anesthesia is a more well balanced branch if you want it to be balanced. Maybe at the cost of the maximum money that you could make. But yeah, I think it's a fair exchange.
Okay.
So
So, I mean, would you like to even give your opinion about these pain clinics and pain management, use of opioids, or how does it differ in pediatrics?
So I'm a pro opioid person. I know there is always a debate whether, like nowadays they talk about opioid free analgesia. I am not. I don't have that much experience in pain medicine, but I do know in the long term for chronic pain, using opioids over a long time does have its side effects. But in what I'm used to, I work in the OTs and I just deal with post operative pain and acute short term pain. I love opioids. I think especially for kids, they act very well. They do have their side effects, and you should just be careful and make sure everyone who's taking care of these patients know the side effects and know what to look out for. But for short term, I do love opioid analgesia. I think it's great. But yeah, it depends on for what you're using it, how long you're using it.
Okay. So, like in general, if a patient comes to you for pre-anesthetic checkup, so he'll have these questions like, will I get addicted to that? Will there be long-term effects? So, what do you want to like clarify regarding this?
So if it's a one-time surgery, a one-time thing, using opioids during the surgery and maybe immediate post-op, it's unlikely that people get addicted to that. Only if it's something which maybe a major surgery, they're coming again and again. Only in that case, you'd have to use opioids sparingly and be careful and look out for the signs of addiction. But other types of painkillers also work beautifully. So if you taper off, I think if it's a good balance. It's called multimodal analgesia. So if you use a good balance of everything, it's unlikely that a normal patient would go into addiction.
So, this is like out of the blue question. What is one complication that you wouldn't want to see in your OT when you're handling a kid inside?
It's common, but I think anyone would say bradycardia. So especially in kids. So in adults, you check the BP and the heart rate, and that usually shows that the patient is stable. But in children, their whole dynamics are based on their heart rate. So if you see that there's a drop in heart rate, then that's quite alarming. And if anything else, if the heart rate of a child is good, then you're okay. But if the heart rate drops, that is a cause for alarm.
Okay, why is it different?
So, like I said, in kids, their whole stability is based on the heart rate. I think, I don't know how to explain this. I think if the heart rate is good, that means the rest of the body is working quite fine. But I mean, it's something that's very easy to treat. But at the same time, if you don't treat it and you don't catch it fast enough, then it can lead to complications. So that's the main thing we see in kids. If their heart rate is fine, then you don't have too much to worry about. But
Okay. And we always hear this from the patients or the parents that we overorder investigations. I mean, they do not understand, but obviously we understand why we are ordering all those coagulation profile or complete blood count or whatever it is. but they always have this thing that why so many. I mean, also they usually nowadays parents carry the soft copy of the investigation. So they'll be like, "Ma'am, I got it done 2 months ago. Is this valid?" So what is a valid time for all this, and why do we order so many investigations?
So I know a lot of hospitals ask the anesthesia team for like a protocol that 1 to 10 years these are the investigations you get, 10 to 20 years these are the. It's never like that. From my side, I don't like asking too many investigations, especially in children, because even pricking them for that particular blood investigation can cause trauma. And then when they have to come to the hospital next time, it just gets difficult to manage them. So, what I believe is it's 100% according to the patient, according to clinically how they seem, what surgery they're undergoing, major or minor, any diseases they have which may cause, like if you're expecting abnormal investigations, then definitely you can ask. Or if by asking these investigations it's going to change your plan of anesthesia, definitely then you can ask for investigations. But otherwise, if it's a healthy looking child undergoing a minor surgery and you're not expecting any complications, I'm okay to go ahead with no investigations at all.
Okay, so it is like it depends on the patient.
100% always
Patient to
depends.
patient, the thing differs.
Depends on the patient, depends on the surgery.
So also, like I have seen this pattern. I mean, everyone would have noticed that usually after MD for anesthetists, there are more opportunities outside as well. So you can enter the Middle Eastern countries. You can write up. You can join the Dubai, like administrative this thing. Like here, how there is the NMC and everything. You can settle there, or you can go to UK, you can go to Australia through the ANZCA. So why do people opt to go outside? Like, are the conditions not good here? Are we are not well paid, or we are good paid outside?
um, like personally, I work in Bangalore, so I cannot speak for the whole of India, but I think Bangalore has a nice life. I think my current job, or many of us who work in corporate, we have a decent work-life balance. So there is no extreme need to leave for another country. Personally, if I think of leaving to another country, it's just for experience. So like people say Western medicine is better, so I want to go personally and see how are they better, maybe get a few years of experience there, improve myself, and then probably come back to India. And when it comes to money also, I think we're fairly paid in India. Definitely in other countries they pay much better at the cost of living there as well. But I think a lot of times it's just for the experience, it's for a different lifestyle. And a lot of people nowadays are tending to come back, so they do go to other countries thinking it's very lavish, but they end up coming back to India, they miss the life here. And also I'd say, I think in India we have this mentality of overworking. It's glorified a lot. You stay back, you are expected to stay back past your hours, and that can get frustrating if your work is busy. I think in other countries it's more strict. These are your hours, you work for
Yeah.
these hours and you go home and nothing extra is expected of you. So maybe people, if they feel they don't have a great balance here, they do like to go to other countries just for that more leaves and better timings and better money. That doesn't always equate to a better life, but at least it's worthwhile to go and experience and see
Yeah.
for yourself.
For the experience and for the newer gadgets. So, given this, how long do you think it'll take for India to improve all these procedures like artificial intelligence to enter into our OPs?
I kind of feel India is doing a great job. I mean, a lot of the hospitals in Bangalore, top tier hospitals, they're not doing anything less than what the Western countries are doing. And especially given the volume, the number of patients we have, I don't think we are behind. It's just it has been all these years that the Western countries are very ahead. But I think in the last 1 2 decades, India has also caught up.
So right now the NEET PG counseling is ongoing. So we have got a lot of DMs actually that, ma'am, should I take up anesthesia? I've got this seat. Should I let it go? I mean, how would you clarify these doubts?
I think because in MBBS we don't have that much exposure to anesthesia. A lot of the times when you just graduate from MBBS, you don't know what anesthetists do. And like I said previously, it's not very glorious. You don't get very famous as an anesthetist. So I personally wanted to become a surgeon, but I got an anesthesia seat and I was fine. I thought, okay, let me go ahead with this. And once I got into anesthesia, I have no regrets now. I know the problems that surgeons go through. Of course, we have our own problems, but I'm quite settled as an anesthetist and I'm very happy with what I do and it gives me good satisfaction. So if you're okay with kind of taking a back seat maybe and not being in the limelight, not being chased after by patients, if you're okay with being satisfied with what you do as an anesthetist and being helpful for the patients and the surgeons, then I think it's a great branch. And it has a lot of medicine. And after anesthesia, you can also go into critical care, which is more fully medicine. So I think it's a great branch to be in, depending on what your interest is. Similar to medicine, it does have a lot of physiology, and we also do a bit of treating on our own, in our own way. But I think it's a great
You
branch.
know, right now there's some of the people have a joke among anesthetists that I wanted to escape from physics and math, and I ended up in anesthesia where you have to do all the calculations.
No. Yeah, I was recently telling someone that, especially for our entrance exams into other countries, we do have to get into physics. They're like, physics? It's like, yeah, anesthesia has a lot of physics, whether it's gas laws or all these, all the laws that you have to study. Definitely, we do a lot. We get into quite some depth at the basics of anesthesia. So, anatomy, physiology, biochemistry, nobody can escape it. So,
So I totally like the vibe that you are, just having it here. That you love the job, you love what you do. That's why you have that work-life balance. I have to really take inspiration from this, where you are also diplomatic and you like to, have your free time. You also restore your peace of mind. That's really interesting. I mean, everywhere they glorify this toxicity and this overwork. I mean, everyone should have this kind of mindset.
I think it took a long time to get here. Definitely at the beginning of your career, you have to hustle a bit. It is exam after exam and fellowships or super specialization. The beginning of anyone's career will be a bit hectic, but then you should aspire to reach a place where you don't have to drain yourself and burn out for the rest of your life.
You look forward to
Yeah.
your day.
So
That's nice. What do you do in your free time? I'm like, I mean, I know that you're a Harry Potter fan. Apart from that,
So I do have a lot of hobbies. I like to, and because now I have the time to do things, when it comes to activeness, I love playing badminton and I like picking up new hobbies. So I'm trying rock climbing and, I'm training to get my scuba certification also.
nice.
So I think because I live in this amazing city, you have opportunities to do anything and everything. So I think you should try if you have the time and while you have the energy, try things like this. And I love reading. I try reading a lot, movies, Netflix, like anyone else. So I think it's important to try things. You never know what you're into or what you're good at until you try. So I try to dip my toes in whatever I
So,
can.
like being an anesthetist is a part of your job, not your whole identity.
Yeah, I try to make it not my whole personality. I like having other things to me as well.
It's really nice and intriguing. So, like before we end this podcast, anything that you want to say to our audience?
Um, I hope I've opened your eyes to what an anesthetist is. If you didn't know till now, it's not a branch that everyone knows. But I think, yeah, I hope I answered your questions fine, and I hope it's okay. And I hope I'm showing people that there's a lot more to doctors' life than just being nerds and being working 24/7. We do have lives, we do other things, and there's it's not like Grey's Anatomy where we're just working and we love only working and we love only being in the hospital. We do other things as well. We are interesting as well.
Thank you for this amazing podcast. It was really fun, and the vibe and your aura. It is so. I would say that this was a very nice, fun podcast to shoot.
Thank you so much. I had a great time.